Welcome to Module 4, an introduction to the Women and Newborn Health Service for Consumer Representatives. My name is Jeffrey Williams. I am the Executive Director of the Women and Newborn Health Service, or WINS, and I'm delighted to welcome you to our Consumer Advisory Council, commonly referred to as our CAC. Consumers play a key role in all aspects of care at WINS, which reflects our commitment to working in partnership with consumers to design, deliver, and evaluate our services. We're very grateful to you for joining us on our CAC, our peak consumer body. I'd like to take this opportunity to acknowledge the Noongar people as the traditional owners and custodians of the land on which we work, and pay our respects to their elders, both past and present. North Metropolitan Health Service recognises, respects and values Aboriginal cultures as we walk a new path together. The Women and Newborn Health Service provides clinical care to women, infants and their families. Our services include King Edward Memorial Hospital, the maternity unit at Osborne Park Hospital, and other specialised statewide health services, including Breast Screen WA and the Sexual Assault Referral Centre, or SARC. King Edward Memorial Hospital is the state's largest maternity hospital, consisting of 197 beds, and we are the referral centre for complex, high-acuity pregnancies in WA. WINS employs over 2,400 employees, and across our services we provide care for 7,500 births per year and 45,000 gynecological occasions of service for conditions including general gynecology, gynae-oncology, endometriosis, IVF, and urogynecology. I'll take this opportunity now to introduce you to Delaney Gibbons, the WINS Director for Safety, Quality and Performance. Delaney is the executive sponsor for our Consumer Advisory Council and will provide some more information to you about the WINS governance as well as consumer engagement at WINS.
Hello and welcome. My name is Delaney Gibbons. I'm the Director of Safety, Quality and Performance for the Women's and Newborns Health Service and the Executive Sponsor for the WINS CAC. It is a pleasure to welcome you to the WINS Consumer Advisory Council. You are about to join a diverse, passionate, committed group of consumer representatives to inform and influence how care is delivered at the Women and Newborn Health Service. As you can see in our governance structure, the WINS Executive Committee is the peak governance body of the Women and Newborn Health Service. The membership consists of the WINS Executive Team, plus the Consumer Advisory Council Chair and the co-chairs of the Aboriginal Health and Wellbeing Advisory Committee. The Executive Committee is the operational decision-making and planning team for matters of service delivery and ensures the provision of integrated and effective delivery of quality healthcare across the health service in accordance with the WINS operational and strategic plan. The WINS CAC is the peak consumer advisory committee to the WINS Executive Committee. The CAC contributes to health outcomes of our patients by ensuring the experience and journey of consumers, their carers, and family is person-centered. In addition to members of our executive team regularly attending CAC meetings to provide you with overviews and updates about our services, your CAC chair sits as the member of the executive committee to formalize the relationship between the CAC and the organization. This also ensures consumer representation at the highest level of local governance. WINS also continues to build a broad consumer and carer network of those with experience using WINS services. Consumer representatives engage in many capacities, including in advisory roles, by participating in governance committees and projects, and by providing advice based on experiences as a service user or carer. Our CAC members and consumer representatives receive support from our Consumer Liaison Service, which is led by John Day. I'll hand over to John now and look forward to working with you.
Hi, my name is John, and I'm the manager of the WINS Consumer Liaison Service. In my day-to-day role, I manage patient feedback, which includes both compliments and complaints. Additionally, I help to onboard new consumer representatives and act as a first point of contact for you in your role as a consumer representative. I also attend the CAC as a non-voting member, so our paths will cross regularly and I'm always here to help. At WINS, we regularly seek and review information that can help us to identify areas where we are performing well and where we might need to make improvements. We also provide regular consumer access and experience reports to the CAC to help identify where the CAC may be able to provide support and guidance to the organisation to improve consumer experience and outcomes. This information is also helpful when developing your annual CAC operational plan. As well as the complaints, contacts and compliments we receive from our patients, there are several other sources of data available. This includes data from clinical incidents and data from safety and quality indicators such as the Hospital Services Performance Report, known as the HSPR, and the Safety and Quality Indicator Set, known as SQUIZ. WINS uses this information to drive improvement. In Western Australia, all hospitals within the public sector use the MySay survey to continuously monitor consumer experience across the organisation. There are 3 MySay surveys that are used at WINS: MySay for inpatients, MySay for outpatients, and the MySay survey for those attending our emergency centre. Each of the surveys include a question asking if the consumer would recommend our service to a friend or family member. The response to this question provides what is known as the Net Promoter Score, known as the NPS, which indicates the degree to which the overall consumer experience is positive or negative. At WINS, we welcome all forms of feedback as it provides us with an opportunity to make improvements that benefit our patients. Complaints, contacts and concerns are all forms of negative feedback where consumers, carers or family members may contact us directly about a negative experience they've had within our service. Excluding breast-green WA, WINS receives on average 22 complaints per month. We also receive compliments, on average 31 per month. Each complaint or contact may involve more than one issue. A review of our data indicates that communication is the issue most commonly raised by consumers or carers. Concerns about inadequate treatment and delays in admission or treatment are also frequently raised as issues. These issues are common across most health services. As you can see, the most common outcomes for complaints and contacts is to provide an apology and explanation to the patient or carer. It is important to us that we respond with care and compassion to patients who reach out to share their experience. As a member of the CAC, you will have the opportunity to review anonymous complaints and the health services response to ensure the written responses we provide to patient complaints are the best they can be.
Thank you for taking the time to complete this module. We look forward to your involvement as a consumer representative on our CAC.